Hello friends, today continuing with the vitamins. Yesterday in nutrition and health we have covered fat soluble vitamins. These are the contents as you are knowing. So in vitamins we have seen the definition, the characteristics, then classification. Now there are two classes as you know, fat soluble vitamins and water soluble vitamins. So depending upon their solubility they are classified. Now yesterday in previous lecture fat soluble vitamins we have covered their functions, their deficiency disorders, their important sources and daily requirement. So four important fat soluble vitamins we have covered: vitamin A, D, E and K. Now water soluble vitamins. Now this group includes B complex vitamins and vitamin C. So B complex vitamin and vitamin C. Vitamin C we can say it is a non-B complex vitamin. So one by one we will see the detail of these vitamins, and in B complex there are B1, B2, B3, B5, B6, B7, B9, B12. These are important vitamins and the question is asked on their daily requirement, functions, then deficiency disorders also. So one by one we will see this. First one is B1. The other name also you must know. The other name for B1 vitamin is thiamine. Now this thiamine, it is soluble in water and alcohol but insoluble in fat. So depending upon solubility already you know, isn't it? Then this vitamin, it is producing energy from carbohydrates. Then proper nerve function, it plays important role in nerve function. Then stabilizing the appetite, isn't it? Then ATP production. What is ATP? That you will learn in biochemistry. And this also promotes growth and muscle tone also. Tonicity of the muscle, that is the contraction and relaxation of muscle as well as the growth of the muscles, isn't it? So it is essential for normal growth and health of the body also, isn't it? Now, these vitamins act as a catalyst as we have previously discussed, isn't it? So, their presence in the body is very important. Their required quantity is very less, they are required in very small quantity. But if they are absent, if they are deficient, so all important functions of the body they are affected. So, this is importance of vitamin B1. These are the important sources of thiamine vitamin, isn't it? It is found in bread, isn't it? Then cereals, isn't it? That is the bajra, wheat, rice, isn't it? Then fish, lean meats, and milk. These are important sources of thiamine, isn't it? Now, deficiency of B1, it leads to beriberi. Now there are different types of beriberi: wet beriberi, dry beriberi. Beriberi is a vitamin B1 disorder, isn't it? Then infantile beriberi, that means it can be seen in case of small children also, those who are below 1 year of age. Then Wernicke's encephalopathy. These are important disorders of B1 deficiency. Apart from this, there is neuritis, then loss of appetite, isn't it? Then tonicity of the muscles, atony is there, mental depression, isn't it? Anemia. So these effects can be seen. The functions that are carried out by a particular vitamin, if deficiency is there, all those functions get affected and those symptoms can be observed. Now the daily requirement of thiamine vitamin is 2 milligram, isn't it? This may increase in certain conditions, like if there is a loss of blood, hemorrhage, if the person is shocked, or if some severe disease is there. So in those conditions, excess amount, additional doses of these vitamins are required. So this is just to make you understand that how the very affected child is seen, it is observed, isn't it? So these symptoms can be seen in case of adults also if there is deficiency, isn't it? Next is vitamin B2. The other name for B2 is riboflavin, isn't it? Now, this with riboflavin is concerned with normal protein, carbohydrate, and fat metabolism, isn't it? It is associated as coenzyme in tissue oxidation and respiration, isn't it? So it acts as an antioxidant. The important sources of riboflavin, as you see on the screen, so liver, green leafy vegetables, kidney, then fruits and vegetables, fresh fruits and vegetables, milk and meat. These are the important sources of riboflavin. Now, this riboflavin is synthesized by bacteria in large intestine, which is an additional source. Now, deficiency of riboflavin can give rise to itching and burning eyes. So, burning sensation is there, redness may be there, isn't it? Then, cracks and sores in mouth and lips. Then, bloodshot eyes, that is the redness, dermatitis, oily skin, and there may be digestive disturbances also. There is retardation of growth also. The adverse effects are seen on the growth, general growth. Then angular stomatitis and glossitis. These are also two important deficiencies. Angular stomatitis related to stomach and glossitis. Next vitamin is niacin or vitamin B3. Now, this B3, other name as I said, it is called niacin, or it can be called as nicotinic acid also, isn't it? Or in some books it is given as pellagra preventing factor. Now the main deficiency disorder of this niacin is pellagra. So this vitamin prevents pellagra, isn't it? Now this pellagra, what happens is this disease is characterized by scaly sores, isn't it? So reddish source you will find as it is displayed on the slide, and there are mucosal changes also. Now this acts as a coenzyme. It is acting in the body as a coenzyme, isn't it? So in biochemistry you will learn about the enzymes and coenzyme, isn't it? So some enzymes cannot work alone. So some enzymes act as a coenzyme, isn't it? Along with the primary enzyme, these enzymes act as a coenzyme, isn't it? So niacin also acts as a coenzyme for fat and protein and carbohydrate metabolism and for tissue respiration. Now the daily requirement of niacin is 50 milligram, isn't it? It may be up to 50 milligram, but it is daily requirement is 12 to 18 milligram. 50 milligram it is given in deficiency disorders, isn't it? Now, the oral manifestations seen in pellagra. Now we know that pellagra is the main deficiency disorder of niacin vitamin. So orally what changes take place? We have seen that this pellagra give rise to the scaly mucosa, isn't it? So inside the mouth you will see that the mucus gums they become very reddish and they are painful, and this give rise to increased salivation also. On tongue also the changes are taking place. The epithelial whatever the layer is there of the tongue that gets desquamated, isn't it? Then the papillae may become enlarged. Now, papillae, you can see the front portion of the tongue, isn't it? So, a swelling is there, isn't it? And it becomes reddish. These are the changes that are observed in deficiency of niacin. Now, apart from this, the person suffering from this deficiency may suffer from diarrhea, dermatitis, dementia. Dementia, it is related to the brain disease, isn't it? Severe deficiency also may be observed, and that gives rise to pigmentation of the skin, isn't it? Now, this skin may be related to the hands, feet, face, and neck. Now, it also leads to weakness, anorexia, insomnia, and mental depression, isn't it? Now, this pellagra is found in those areas where maize and jawar is the main source of food, isn't it? Now, sources of niacin, you will see yeast is the main source, then the cereals, pulses, nuts, meat, liver, isn't it? Green vegetables, isn't it? Eggs. So, these are the main sources of niacin. Next is pantothenic acid. Now this is vitamin B5. Now the daily requirement of this pantothenic acid is 10 milligram. In children's 5 milligram or 5.5 milligram can be given, isn't it? Then there are many health benefits of pantothenic acid. It provides relief from fatigue. That means the person who is very much tired, uh, so that fatigue also can be cured, or the person who is suffering from fatigue means there are chances that there may be deficiency of pantothenic acid. Then it regulates cholesterol level and controls blood pressure also. It also reduces stress, tension, depression, and anxiety, that is restlessness. It gives strength to our immune system. So, our immunity is also increased with pantothenic acid. Then, hemoglobin level is also increased by this B5 vitamin. Then, the metabolic functions of the liver are also promoted by this vitamin. Then it relieves from the asthma. So some diseases are there like asthma, Parkinson's disease, autism. So they can be prevented by pantothenic acid. Then the skin and hair are also healthy by these vitamins. Now, the deficiency disorder of pantothenic acid is Gopalan's burning foot syndrome, manifested as paresthesia, isn't it, in lower extremities. Sources of pantothenic acid: yeast, meat, and liver. Then vitamin B6. Now the other name for B6 is pyridoxine. Now this pyridoxine is important for maintaining healthy brain functions, formation of red blood cells, breakdown of protein, and synthesis of antibodies in support of immune system. Now it is, as I said, essential for metabolism of amino acids, fats, and carbohydrates, isn't it? Then for hemoglobin synthesis, isn't it? It is also called as anti-dermatitis factor. These are the important sources of pyridoxine: yeast, then fresh fruits like banana, isn't it? Avocado, watermelon, isn't it? Then sweet potato, salmon fish, egg yolk, cereals, isn't it? Green turnip. These are important rich sources of pyridoxine. Now the daily requirement of this pyridoxine B6 vitamin is 2 milligram. Deficiency is rarely observed in human beings because enough pyridoxine is present in diet, in food that is consumed by human beings. Now, the deficiency can lead to weakness, sleeplessness, peripheral neuropathy, personality changes, dermatitis, and glossitis. It may give rise to convulsions also in some cases. Next vitamin is folic acid. The other name is vitamin B9. In some books, you will find other name as vitamin M or folacin also. Now, this vitamin is essential for synthesis of DNA, isn't it? It is stimulating blood formation, and also it takes part in maturation of red blood cells. It is extensively used in anemia like macrocytic anemia and pernicious anemia. The daily requirement of folic acid is 100 to 300 microgram. These are the important sources of folic acid like beans, legumes, citrus fruits, juices, whole grains, dark green leafy vegetables, poultry, shellfish, and liver. Now, deficiency of folic acid give rise to sensation of weakness, numbness, and tingling of fingers and toes. There may be ulceration in mouth, sore tongue, feelings of weakness, isn't it? Then the next vitamin is B12. Now, the other name of B12 is cyanocobalamin. Now, this is important for metabolism, the formation of red blood cells, and the maintenance of central nervous system, which includes brain and spinal cord. Now, these are the important sources of vitamin B12: chlorella, milk, oyster, eggs, then spirulina, and meat. Now, this B12 is also called anti-pernicious anemia factor. We have seen that it is essential for normal functioning of all cells. It plays important role in carbohydrate, fat and protein metabolism, and it is also essential for formation and maturation of red blood cells. Now, deficiency of B12 we will see cyanocobalamin. So, deficiency leads to fatigue, that is tiredness, then shortness of breath, panting, palpitation, meaning irregular beating of heart, that is called palpitation. Now, this B12 deficiency may also be caused by lack of intrinsic factor and give rise to pernicious anemia. Now, this happens due to the poor absorption of B12 in the body of the person. Now, it is also said that the deficiency of B12 is also linked with the deficiency of vitamin folic acid, that is B9. The requirement of vitamin B12 is 30 microgram to 1 milligram. Then the last vitamin in water soluble vitamin group is vitamin C, that is ascorbic acid. It is water soluble, it is unstable in all the vitamins because it is readily destroyed by exposure to air and heat. Now, many more important functions are associated with vitamin C. It promotes healthy immune system, helps wound healing, maintains connective tissue, and also helps in absorption of iron in the body. So cellular structure is also maintained, like synthesis of collagen, the protein that binds the cells together. Now this collagen protein plays very important role. If it is not formed, then healing of wounds will be delayed. Then maturation of red blood cells, tissue oxidation, absorption of iron, then general resistance of body to fight infection. So that means it promotes a healthy immune system. It is also involved in synthesis of adrenal hormones. Then important sources. So all citrus fruits are rich sources of vitamin C, like orange, lemon, tomato, papaya, potato, cabbage, spinach, pulses, avla, guava. Now these fresh juices of avla contain nearly 20 times as much as vitamin C as organic juice. And a single fruit of avla is equivalent in vitamin C content to 1 to 2 oranges. Deficiency of vitamin C. Now, vitamin C deficiency is called scurvy. Now, this scurvy can be seen in infants also, small children's. So that is called infantile scurvy. In that, lassitude, anorexia, painful limbs are observed in case of small children's. Then folliculosis, that is hair follicles rise above skin. Hemorrhage may take place. So tendency of hemorrhage is there, isn't it? Spongy gums, loss of weight, delayed wound healing, the bones become brittle. So in vitamin C deficiency, there is increased susceptibility to infections. Now, the main deficiency disorder of vitamin C is scurvy. Now, in scurvy, what are the symptoms? So, they are weakness, fatigue, breathlessness, joint pain, tachycardia, gums become spongy, then tendency to hemorrhage, increased chances of infection. Now, the daily requirement of vitamin C is 30 to 60 milligram, which may increase if the person is suffering from disease. The requirement also increase in pregnancy and lactation. Now, since vitamin C cannot be stored in body, so daily intake of recommended dose is necessary for good health. So that is all about the water soluble vitamins. Here vitamins are over. Thank you.